Good morning, Queensland. Good morning to all of our Facebook Live followers as well. So today we have 6 new cases, and we are not too concerned at this stage, but we'll go through it and Dr Young will give further details, and it's going to depend on what Queenslanders do, so I'll come to that in a moment. So we've got 6 new community cases. 4 are linked to the aviation cluster, which is good news. One is a man in his 30s from the Brisbane area. One is a close contact of the case announced yesterday. One is a pilot who was flown into Townsville. Now, this person was fully vaccinated, but I'll come to Townsville in a moment. And a household contact of a previous case, which is a daughter. We also have a person in Camp Hill who had recent travel into New South Wales. Close contact of a New South Wales case, and Dr Young will go through that issue. And the final one is detected in a hotel quarantine. It was a returning Queensland resident who was coming back from Melbourne but was infectious on the flight. So that, shows very clearly that you can still acquire this virus in other states and bring it back into Queensland. So we have 22 active cases. This is good news. We've had 14,216 tests in the past 24 hours, so well done, Queensland, but we want to see a lot more testing over the next 24 to 48 hours. In terms of vaccines, we had 22,225 vaccines administered by Queensland Health yesterday, and that now means we have 65.15% at least one dose and 46.17% people who are fully vaccinated. Okay, so what does this mean? So there's a couple of things. We've got a couple of key measures we're going to be looking at, and of course we're going to be asking Queenslanders to step up and do some other things. So first of all, key is testing. So we need people who have any symptoms whatsoever. We want to make sure that this is not seeding into the community. So if you have any symptoms whatsoever, come and get tested. That's why the next 24 to 48 hours is going to be very critical to see if there is any seeding. The next key, of course, if you're not vaccinated, go and get vaccinated. That is absolutely crucial. Also too, masks. Can I just stress to everyone, I need Queenslanders, especially in the southeast, to be wearing their masks. The best way not to get this virus is to be vaccinated. Second is to be wearing your mask. And thirdly is using your check-in app. So I'm asking people, and Queenslanders have done a great job, and they've done this before, and I know they'll step up to the challenge and do it again. So what does this mean? This now means that from 4 p.m. we're going to introduce some further restrictions. So this will apply for the next 2 weeks, and this is going back to our stage 2 measures. So from our roadmap, you can all look at the roadmap. We'll get that up on out to people. We'll be going from stage 3 down to stage 2 for the following areas. So this needs to be very clear to people as well. These new restrictions commencing from 4 p.m. today for 2 weeks will apply to Brisbane, Gold Coast, Moreton Bay, Logan and Townsville and Palm Island, because we had that pilot that flew into Townsville. That means that the number of people allowed into your home will be 30, including visitors, residents and children. Weddings and funerals will go back to 100, 20 people dancing at weddings. Restaurants and cafes, for the 2 weeks will return to the 1 person per 4 square metres. I think everyone realises that we've got to put these restrictions in place if we are to avoid a lockdown at this stage. Okay, so I want everyone please to take this very seriously and to please do the right thing. And I'm quite sure that we will be able to get through this like we did previously if we all do the right thing. So good news in that those 4 of those 6 cases were linked to that cluster. But of course, testing is absolutely crucial. So any symptoms out in the community, anyone in your family has any symptoms whatsoever, just wait till someone turns off their phone. Thank you, that's right. If anyone has any symptoms in your family whatsoever, it is absolutely crucial to go and get tested. Okay, so I will hand over to Dr. Young to go into a bit more detail about those cases, and I know that everyone will do the right thing. Thanks.
Thank you very much, Premier. So yes, we have 6 new cases to announce today, 4 of them linked to our aviation cluster. And it looks like we think the event where all these people were exposed and got affected happened on the 20th of September. We've still got to do a bit more work to clarify that, but we believe that's when it occurred. So that we think people started being infectious in the community from the 21st. So now we have people who live in Townsville, Hamilton, Bigara Waters at the Gold Coast, North Lakes and Eaton's Hill, who've been amongst those 8 people. 7 of them are currently in Queensland, 1 of them's currently in New South Wales. And as a result of those people being out infectious in the community from the 21st, we have multiple exposure venues across Brisbane, Moreton Bay, Gold Coast and Townsville. So it's very important if people have been in any of those LGAs since the 21st to please go online and check for all those exposure venues. There are quite a number of them. Then those are 4 cases, they're all clearly linked, and we haven't had general community spread from them. So all of those cases have been people who were either at that meeting or had close links to someone who was or a household contact. So that is very good news. Then we have another case that's totally unrelated to that outbreak. That's a woman who lives in Camp Hill who went down to Kyogle and came into contact with a known case down there, returned home to Camp Hill and has been infectious in the community from the 25th through to the 28th of September. I already have her whole genome sequence result back. I just got it before this press conference. She has Delta variant, not clustering with any other case in Queensland, which makes sense as we do believe she acquired that in Kyogle. Then we have another case who flew up on flight VA333 from Melbourne to Brisbane on the 27th of September, went into hotel quarantine. They're a Queensland resident who was returning home to Queensland. So they went into hotel quarantine and got tested there as per our protocol, and that also, I have her whole genome sequence back as well. She has Delta that is not clustering with any known case in Queensland, which is to be expected as we believe she's acquired that when she's been in Melbourne. So we will be able to look at her whole genome sequence against those sequences circulating in Melbourne. So those are our 6 new cases today. We still have that Spring Hill cluster. No further cases though, due to that truck driver who came up from Sydney and had been infectious in the community. And we also have that cluster in Gavin due to that truck driver who lives in Gavin but is currently now back in New South Wales. He regularly moves goods from the Gold Coast down to Sydney and back again. So he's currently in New South Wales. And it took us a while to get all of the absolute details of where he'd been when he was home in Queensland, but we finally got them on our website late yesterday, and thank you to everyone I know who's been looking out for those details and has been working through them. Thank you for that. So although we haven't seen any community cases expand out from any of these known clusters, there are so many of them now, which is a concern. So I think it's important that we do put some restrictions back in place, as I advised the Premier this morning. So thank you. I know they're annoying for people, but people are so good at following them. So we know homes are the highest risk, so that's why we're bringing back that maximum of 30 people in anyone's home. And we know gatherings like weddings and funerals, so that's why there's that limit of 100 there. Plus we need people to return to being seated when they're eating and drinking. because it's when you get up and wander around that it's hard to know who you've been in contact with. So to be seated when you're in cafes and pubs, and also in those larger venues, we've capped them now at 75%, just to decrease the numbers of people coming into those larger venues. And it's critical that people wear their masks at their entire time when they're in those larger venues, whether they're cinemas or theatres or sporting events. Keep your mask on unless you're seated and eating or drinking, but the rest of the time we know masks work. We know they're very effective. So that's been brought in for Townsville because one of those pilots involved with the aviation cluster went up there back on the I'll just have to check that date, but he's 21st, thank you, Premier. So he went up there on the 21st and has been infectious up there since then. So we need Townsville to come under these restrictions. So he's been staying in one of the hotels in the centre of Townsville, but has been out and about. So that's why it's so important to include Townsville. They'll be under the same restrictions as those 4 LGAs in Brisbane. So Moreton Bay, Brisbane, Logan and Gold Coast. Thank you.
So, as the Premier said, testing and vaccinating. So we will have extended testing in all of those LGAs. We have the Queensland Ambulance Service standing up a new pop-up 24-hour testing clinic at 8 Mile Plains in 51 McKenny Drive. It'll be stood up from midday today and it'll be operating around the clock. So we know this is a really good site. It's got great parking capacity, and so we will have that operational from midday. Also, our private pathologists, we thank them again, who are making sure that in those LGAs you do not need a referral. You can walk straight in to get a test, as well as, of course, the Commonwealth and the state testing clinics. Sullivan Nick ladies have set up a drive-through clinics at Brendale and South Brisbane as well. So again, I repeat, private pathology providers in the relevant LGAs, Brisbane City Council, Moreton Bay Regional Council, Logan, Gold Coast and Townsville, you do not require a referral. So latest reports show there's very short waiting lists at our testing clinics. So if you have the slightest symptoms, even just a headache, please come forward and get tested. Now, all of the Queensland Health Community Vaccination Centres across Queensland are now walk-in centres. You do not need a booking. From today on, you can walk into any one of these centres. So we have the big mass vaccination centres, the Brisbane Convention Exhibition Centre, we have Boondall Entertainment Centre, we have Logan Entertainment Centre, but we have community hubs right across the state. So please come out and get vaccinated. As I said yesterday, that if you want to be fully covered by the end of October or November, you have to be vaccinated today, because it takes at least 5 weeks from your first vaccine for you to be fully covered, because it's 2 weeks after you get your second vaccination. I also remind people that they can book in with GPs who have got AstraZeneca and Pfizer, or they can book in with or walk into a community pharmacy, and lots of community pharmacies are starting to get Moderna now. So again, if you are 12 or older, you can get Moderna or Pfizer, walk into any of these centres and please get vaccinated. So there's lots of options. There is no reason to delay, and in fact, it is not in anyone's best interest to delay. I say this because Victoria has reported 1,438 cases today, an extraordinary increase in cases overnight. So we expect that Victoria's numbers are going to keep going up. But another figure I want to talk about. Yesterday we saw Victoria and New South Wales announce a combined figure of 22 people had died in 24 hours. 22 people in 24 hours. That means there was someone dying almost every single hour in Australia from COVID, just from 2 states. So we want to make sure that that doesn't happen here in Queensland, that we keep people safe, And the only way to do that is come out and get tested and to come out and get vaccinated. Of course, we're going into stage 2 restrictions. Have a look at the roadmap on our website. It'll outline what those restrictions are. We've been here before. We know how to do it. We know what these restrictions are. We need everyone to comply, because if everyone does the right thing, we can get through this without a huge outbreak in Queensland. So let's all do the right thing, and we can certainly make sure we keep everyone safe. But please wear your masks everywhere, get tested and get vaccinated.
Thank you, Premier. Could I start with saying that we're in a very good place in this state because of the levels of compliance of our community. Yesterday we saw 13,621 vehicles intercepted at our borders, 145 only turned around, and 2 on-the-spot fines for people not following directions from emergency officers. Only 6 masks handed out in our community yesterday despite the increased restrictions. That's very pleasing, no fines around that. But the reminder is there for our community that with the increased restrictions, we will increase our vigilance in what's happening in our community. And a reminder that failure to follow the direction of an emergency officer, which includes police, during this pandemic carries a $1,378 on-the-spot fine. Failure to wear a mask carries a $208 on-the-spot fine, and people breaching our borders can face over $4,000 fine. We don't want to see those sort of fines handed out. We want to see the compliance continue, so please be aware of what the current restrictions are. Work with us. We will make sure that we deal with things appropriately and compassionately, but we need everyone to comply with the current restrictions. Thank you.
Commissioner, sorry, just quickly before you go, is police investigating the Campfield woman who crossed the border, and can you provide any detail on that?
Yeah, no, we are investigating it. There are a number of investigations in relation to people that have come across our borders recently that have gone positive. They are still ongoing. We don't have outcomes. We will advise once we get that. Thank you.
Premier, I think some people might be surprised we're not going into a lockdown yet. Are we getting closer? And also for the NRL Grand Final, what changes are going to take place there?
Look, I think Queenslanders know we'll always put the health of them first, and that's exactly what we'll do. This is the advice that's been provided to me by Dr Young, and it's going to depend each day how things progress in this state, whether Queenslanders wear their masks, whether they go and get tested, and, you know, the fact they need to go and get vaccinated, and the fact that we've got 4 of those that are linked to that cluster, plus health have got all their contact tracers working and putting people into isolation. So it's going to be very critical the next 24 to 48 hours about whether or not we see any seeding into the community.
Premier, there's a lot of people out there who believe the only reason we're not in lockdown is because the NRL Grand Final.
Well, that's not correct.
Has it had any influence at all in any
None,
decision-making?
absolutely none. And let me make it very clear that the health of Queenslanders comes first, and as soon as Dr Young says we need to move into a lockdown, we will.
So when previously, when there was a lockdown, say for example when the women worked at the Prince Charles Hospital went to council, so why not this time when we've got more cases?
We're actually moving to tighter restrictions. Our vaccination rates are up. People are checking in, but as soon as we see further seeding, which is not from people who are in isolation, then they will be the trigger points that Dr Young will look at.
For the NRL Grand Final, though, there's going to be reduced capacity.
Correct.
What happens to those ticket holders?
Well, you'll have to talk to the stadiums and NRL about that, but they can factor that in.
So that's got thousands of people missing out.
Well, it's going to be disappointing for people, but we have to take the health advice. The health advice is to move to stage 2. Stage 2 says 75% capacity. That's what it will be.
Then there will be institute modelling that National Cabinet will consider on Friday, looks at the effect on Indigenous communities and in schools. Do you think after you review that updated modelling you'll be able to have a better idea about re-estimating?
Well, when I get that updated modelling, I'll have a look at it and we'll be discussing it at National Cabinet.
Is there any other kind of modelling you'd like to be done or to see before you make a decision about the borders?
We will have discussions at National Cabinet. I'm not going to preempt National Cabinet.
Would you consider going ahead with the grand final without crowds? I guess people are a bit confused that it's 12,000 in the stadium, but they gather into the stadium.
Look, if that's a consideration that may have to be made at that time. At the moment, that's not the situation. So I just say to people, If you are sick and you have any symptoms, you need to go and get a test. Okay, so this is very critical. We want to see high testing rates, and we'll be watching very carefully what happens over the next 24 to 48 hours.
Restaurants and cafes will be asking, how is it safe to have 40,000 people in a stadium while they have to have the 1 per 4 square metre rule?
Because everyone will be wearing a mask going into the stadium, Tim. Yeah. Okay? And while they're seated, they have to wear the mask as well.
Is that a council pilot state the same hotel as the lot of it? Do you have any information?
Not to my knowledge, but we'll check that out for you.
I mean, what do you make of the Camp Hill one? I know the Deputy Commissioner said it,
Yeah.
still looking at it, but you've praised Queenslanders for doing the right thing, and we've seen a few times in the past few days people who may not have done the right thing. What's your message?
I'll let the police do their investigations, but there is a massive outbreak in New South Wales. That's why there are very tight exemptions about what are the reasons to cross that border. And people need to think long and hard about why they are moving and whether or not they comply with those exemptions. So let police do the investigation there. I'm not going to preempt those investigations.
Do you think, will your government look at sort of tightening restrictions? We had a peer truck driver who was able to spend 8 days in the community without protection and travel around. Does there need to be tougher rules on people who are coming into the state?
Well, we just introduced that the vaccination program for freight drivers, which was worked in with the industry. But there is a lot of virus in New South Wales and Victoria, and that is why we are seeing more people testing positive that are coming in from those states.
The Health Minister said yesterday that compliance sometimes provides some exemption past 100%. When do you think the state will be able to extend that trial to more people, let more Queenslanders come in?
In relation to,
Letting more people stuff into state quarantine and time or extend that home quarantine?
I think Understand Victoria's announced a proposal. We'll have a look and monitor how that's going.
Will there be any changes to the border bubble with all of these new restrictions?
Not at the moment, but of course, if there are cases that happen in northern New South Wales, the New South Wales government may take action. Yeah. And then we would reciprocate, yeah.
Yesterday on the coast, there was a lot of mention about Currumbin and Palm Beach suburbs that have been possibly exposed, but then there's been no exposure sites listed for those. And is there any exposure sites down the Gold Coast, extra ones that the public need to be aware of?
I don't think at this stage. I might get Dr Young to address that if I can. Yeah, thanks. Thanks.
I gave some preliminary information yesterday at the press conference about sites I'd been told about, but then we had to confirm all of those with the gentleman, and for some of the sites there was very little exposure and we were able to work out exactly who was caught up in it, so we didn't need to list them publicly. Because I don't want to list more sites than I need to, because there's already far too much information there for people to go through. So whenever we can work out that there's been a site, maybe it might be a workplace, it might be somewhere that they've gone into, and we know we've captured everyone, then we don't list it on our website. But a very good pick-up. Thanks for that, Tim.
Dr. Young, what's your level of concern now?
I am concerned. That's why I recommended to the Premier this morning that we should go to stage 2 restrictions.
But have you recommended at any stage to the government that your preferred response would be a lockdown?
No, not for this outbreak, and every other time it's happened.
Dr. Young, sorry, there's an Argentine rugby league side that's stuck in Byron Bay. Are they going to be allowed back in?
Yes, apparently there are some players who went down to Byron Bay, and I believe that they're staying in New South Wales now, is my understanding.
They can come back to the game again.
No.
So put really simply, they went into Byron Bay. They tried to come back in without the appropriate authorisations and approvals, so they were refused entry ultimately. My understanding is they stayed at Kingscliff overnight. I'm not aware of any exemption. If they are to come to this state, they will have to abide by all the conditions, which would include quarantine. So at this stage, they remain in New South Wales with no exemption to get back in.
Do you have any numbers on how many people have been turned around either yesterday or this week at the border?
So yesterday, Tim, was 145 vehicles that we turned around in total. So the numbers of people would be somewhat more than that. That's pretty typical. We're seeing large flows, as I said, was 13,000 vehicles yesterday. So that percentage is not high. Look, we're still checking. So anyone that comes to our border needs to understand that they, irrespective of who they are, The onus is on the individual when they want to come into this state that they have the appropriate border pass, the appropriate authority, and if they need the exemption, to have the exemption. In this instance, they didn't have that, so they couldn't come in. Beg your pardon? No, we're not investigating that because they didn't get in, so there was no breach occurred. They just weren't allowed to enter the state.
Last week you said that you weren't able to say about what time Queensland had reached that 80% vaccination, so you didn't have certainty of supply. Yesterday you announced that the walk-ins at all 80 vaccination hubs, so we must have some sort of certainty of supply. So when do you think Queensland is going to reach 80%?
No, we don't have the final certainty, so I'm not going to speculate. You know, we want as many Queenslanders as possible to go and get vaccinated. There are walk-ins now, so you can either walk in and get your vaccination, or you can go to your GP or go to your local pharmacy. I need Queenslanders to get vaccinated, and we need as many people as possible to get vaccinated. We're in the midst of a world pandemic. As we can see, we've said that these issues can arise at any time with the Delta strain. The best protection for you and your family is to go and get vaccinated.
If there's not that certainty of supply, how can you ensure that we have enough doses for stepping down?
I think we've got about, is it 13 days at the moment? We've got 13 days of supply at the moment. We'll be getting an update at National Cabinet, which we get every National Cabinet. The General gives us an update on supply, and we are working towards getting as many Queenslanders vaccinated as possible.
I mean, we saw some extra updated exposure sites going up on the website yesterday. It was pretty apparent there was extra cases around. Queensland Health wouldn't tell us about them. Why does Queensland Health persist with this policy of only releasing the numbers at this press conference? Because surely it would be best to get the numbers out there as soon as they're confirmed.
No, what we do, Tim, is we verify everything. Sometimes things need to be double-checked. Depends on the pathology lab that's used. Sometimes we need to go and double-check that. We need to work through, sit down with the person, work out where those exposure sites are, and we give clear and concise information. Well, I believe that we try our very best every day. Someone from the government, and whether it's Dr Young or a Deputy Chief Health Officer, will come out here and give the most up-to-date information that we have. It would be reckless for us not to do that.
Yesterday we were seeing exposure sites listed for confirmed cases now at 3 p.m. Surely if you're listing the exposure
No, well, they
sites,
can put the exposure. I think it's good that Health puts up the exposure sites. They should be putting up the exposure sites.
they don't confirm the cases or any other. They don't answer our questions when we ask them about them.
Well, every state has different methods of conveying their communication, but we give the most up-to-date information that we can at this time of the day for the public. Okay.
Premier, the Tasmanian government, Premier yesterday said that they would only reopen their borders to the hotspot states once they hit 90% vaccination rates. They've commissioned some modelling, state-specific modelling on cases of the reopening plan. Has Queensland commissioned any of its own state-specific modelling around that?
Look, I'm not going to comment any further until we have National Cabinet. I think that's the appropriate place to have those discussions rather than speculate in the media. I will have those discussions at National Cabinet where every state and territory can put their views to the Prime Minister.
Victoria also has commissioned their own modelling. Has Queensland got any modelling?
I'm not speculating on anything. I will wait until I go to National Cabinet. Okay.
From the New South Wales government has been pledging to cut admissions by 50% by 2030. Is Queensland going through increases targeted to meet that?
At the moment we have 50% reduction by emissions by 2050. We've got a renewable energy target of 50% renewables by 2030. You know, it's great to see that the federal government is moving in this direction.
Should people in the region still travel down to the Grand Final?
Sorry,
Should people in the region still travel down to the Grand Final?
there's no reason at this stage not to.
Who decides, Premier, who can't go on Sunday if it's reduced capacity?
My understanding is that stadiums and the NRL have a method where I think there was a number of seats that were sold in stages. So it's going to be unfortunate for people, and you know it is sad, but this is the health advice. So we have to accept the health advice.
Do we know if any of the people who got tickets under the offering for people who got vaccinated at the state level will have theirs?
No, that was for the semi-finals. So that was for last weekend. Yeah.
Are you planning to go yourself?
Sorry?
Are you planning to go yourself to the grand final?
Well, I might if it depends on the situation that we're in. Okay. Yeah.
The rugby players, what do you think of those rugby players from Argentina travelling down across the border? And so is that match on Saturday
I think it's very disappointing, and they won't be playing. I mean, their actions have had an impact on the game. So, you know, there's people they could have checked the rules with, and now, unfortunately, they're stuck in New South Wales. So,
will the government have to pay any compensation to the NRL for cutting the crowd number?
no.
Just on the decision to let the defence at 75%.
There was so much clicking, I didn't hear that.
Sorry, just because people ask what the health advice is. Can you explain what the health advice is for allowing the game to go ahead at 75% capacity while restaurants are reduced to one person per also meet up?
If you go back and look at our roadmap, we've always done it. So we've always had lockdown, stage 1, stage 2, stage 3. So we're going back to stage 2. It's consistent what we've done every other time.
Why is it safe to have those thousands of people in the stadium and reduce their
Because they're ticketed, seated, so you know exactly where each person is. They've got masks on when they're not seated, so we know that the risk is when they stand up and then mingle to leave and enter the stadium. And it's not just for stadiums, it's for cinemas, it's for any indoor event where you've got tickets and seats. So it's the same process that we've always done.
Pardon me, sorry. The Gold Coast exposure sites were from a surfboard delivery driver, we understand, New South Wales. Are you aware of how many businesses were visited or how many people have been put into isolation from that?
I don't have that number with me, but yes, they're working through all of those sites that he was at.
Dr. Young, yesterday you flagged the 6 or 7 Gold Coast suburbs that were
Yes.
affected, gave people plenty of warning.
Yeah.
Do you understand that lots of people on the Gold Coast were really concerned and stressed out yesterday, and when those exposure sites were not released until 6 p.m, people see that there's a delay between us having that information and it being released to Queensland Health?
My intent of providing that information was because I know when I provide that information, when you've got people with any symptoms in those areas, they'll come forward. That's just an extra nudge. People have been really good throughout this pandemic in Queensland, coming forward and getting tested, but I know it helps. I'm sure it helps with you, it helps with me. If you think, oh, maybe I've got a bit more risk because I live in that suburb. That's why I always, and I did it again today, said the suburbs where all of these cases live, because I think that's important. I want people, no matter where they are in the state, to come and get tested. But I do know, human nature, if you give people an extra reason, they're even more likely to. So that's why I went out. So people just need to understand we have got 22 active cases in Queensland today, and they're people who've been out and about to a significant degree since the 21st of September. So throughout Queensland, I need people with any symptoms, doesn't matter how mild, and I thank every single person over the last 18 months who's come forward. I don't know why. We've had brilliant people, a small headache, a tickle in the throat, and they come forward and get tested. That's what I need, and I'll do anything to nudge people, help people, assist people to come forward and get tested. That's critical. And while I'm here, my other critical issue is please don't wait to get vaccinated. I mean, I would never have thought of this pilot going up to Townsville and then spending 7 days in the Townsville community while infectious. I mean, that just came out of left field. When I got that result, I went, oh, where's he from? And then I found out he was related to this cluster. So no one, please think, no one, think you have got time to wait. Now is the time. You must come forward. Anyone who's 12 years of age or older, please don't wait another day. We do today have plenty of vaccine, and it doesn't concern me if we run out, because we'll get more, so we'll manage second doses. It would be delightful if we ran out of the vaccine that we've got on our shelves in our fridges today. There's lots of it out there. There's lots in our clinics, there's lots in our pharmacies, and GPs have lots. So please, remember, going back a few months, we always said the vaccine doses would ramp up towards the end of September into October. This is the ramp up, so don't wait, just come out now and get vaccinated. I don't have that number on me today, actually. We can send it to you, Lydia. That's a good question. Thank you. We had about 1,000 at the end of yesterday.
The aviation cluster, what was the event that those people were at?
It was a meeting that they were at, so part of their business, so the airport.
Do we have
we have 4 clusters. So we have that aviation cluster, we have the truckie who came up from Sydney and lives in Spring Hill, has been staying in Spring Hill. Then we have the lady who went down to Kyogle and came back to Camp Hill. And then we have the other truck driver who lives the Gold Coast and goes up and down between Sydney and the Gold Coast. So 4 separate clusters. Thank you.
It's 11:69.